Here we are again. I'm Ben Watkins, and this is
Gary Kaihara.
and we're the Ben and Gary Show. And here we are on a Friday afternoon, and we're just sort of sitting around and kind of settling in for the evening and getting kind of finished up for the day. And often we have these discussions because things kind of come up. And
Right.
I believe we were talking about patients that have come in to us who have tremendous fear, and they've avoided the dentist for so long, and it just kind of brought up the whole point of like, what the heck is up with that? Like, where did that come from, and where does that get sort of born out of?
Right,
And interesting enough, you had a patient today that came through that had that exact same
Right.
situation. What was it, like 10 years or plus that they didn't come to the dentist
Yes.
because of this fear that they had?
A patient I had did not, had fear of the dentist because of a past experience with his removal of his wisdom teeth. And evidently the anesthetic wasn't real profound.
Right.
But the dentist kept soldiering on until he got the teeth out. But as a result, it just instilled this great fear of the dentist in this patient. And he avoided the dental office for 10 years.
It's incredible.
So, but his physician had recommended us, and so the guy summed up the courage, and he came in, and we talked, and in talking to him, this whole story unfolded. And I was just amazed that he had, the fear was well founded. I can understand that, but he got the courage to come in and told us the story. And I don't know that he was embarrassed, but I felt really a lot of empathy for him because now in our day and age when we have local anesthesia that's very effective, we have nitrous oxide. We have some oral sedation tablets that patients can take to reduce the anxiety, for him to come in and say, okay, here I am, I finally made it.
Right.
And, it was just a pleasure to talk to him, get to know him. And, I told him after we did the examination and all, I said, your teeth are in great shape. It's just that we have to get your gums into better shape because obviously he had some deposits but things are not as bad as he thought they would be. And,
Or maybe perhaps his fear was his own worst enemy.
well, you're right. It was, but I give him credit for coming in and taking care of it. Kind of took the bull by the horns and said, okay, let's get this show rolling.
Yeah, they really shouldn't be embarrassed at that point in time.
No,
We're not here to beat them up or to tell them that why were you away for so long and why did you do something that was that silly.
Right.
I think it should be, like you said, it was important to acknowledge the fact that
Right.
this might have been a really tough thing for them to be able to come to the
Oh, it
office,
is.
and they should
It
be
is.
applauded for it
Yeah.
because he's kind of conquered his fears, at least
Right.
to that point. And then I think it's obviously our job to be able to be the ones that can continue to dispel those fears.
Right. But what I told him was, what's happened has happened, so let's just move forward and do what we can to make you comfortable and get you back into very good dental shape.
Sure.
So he saw our hygienist, who was excellent, and Jennifer did a very nice job for him, and so he'll have to come back for more scaling and cleaning, but he's on his way, but he was just so happy to know that nothing more was going to happen.
Right.
So,
Right, and I'm
yeah.
sure it wasn't nearly as bad as you thought it was going to be.
Right. So it was a happy ending for him because really all his teeth were in good shape, the fillings were in good shape, and just cleaned me up. There you go.
Sounds like you dodged a bullet there because certainly we know people who avoided the dentist for some time and they weren't nearly as fortunate.
Right. But it's always important to take that first step, make the effort to come in and let us assess what's going on because a lot of times, as in his case, it wasn't what he thought it would be as far as his dental decay, and it was non-existent. And so, just come on in. Let's take a look. For those of you who are afraid of the dentist or afraid or have some anxiety about coming in, I know it takes a lot of courage to come in, but I think once you're here, you'll find that things aren't as bad as you may think they are. So.
Right. Don't let your fears overcome what's really good for you and what's best for you.
Right.
Find the right dentist too, by the way. That's also important.
Right.
So it's a brush, floss, repeat, right?
Yeah, I'm going to recommend Ben because he's my dentist.
Vice versa. I got the best.
Right.
So I guess that kind of does it for at least on the
Yeah.
fear factor here of being at the dentist and how we might be able to dispel some of those fears. And you know,
Right.
it really starts with you having the courage to be able to seek out the right individuals to guide your dental health.
Right.
And that's just a good note here for you on a Friday afternoon.
Yeah.
Ben and Gary Show. We know dentistry. Give us your questions. We're looking forward to hearing from you.
Right. Thank you.